When every second counts in the ICU, nurse practitioners are at the front line, not just prescribing medications but performing life-saving procedures. So what exactly can an NP do inside the ICU? Let's find out. Welcome back to the Cosmic NP, a nurse practitioner student in critical care. Today's video is all about the procedures NPs are trained to perform in the ICU, with a quick explanation of why each one matters for critically ill patients. Remember, scope of practice may vary depending on your country and hospital policies, but these are the core skills most NPs are expected to master. The ICU runs on access. Without it, medications and monitoring simply can't happen. Peripheral IV cannulation, inserting a simple IV line for fluids, antibiotics, or pain relief. Quick, basic, but life-saving in emergencies. Central venous catheter insertion, used for giving strong drugs like vasopressors, measuring central venous pressure, or long-term therapy. Arterial line placement allows continuous blood pressure monitoring and frequent blood sampling for ABGs, arterial blood gases, which guide ventilation and oxygen therapy. Vascular access is foundational. NPs often do this independently because waiting for another provider can delay critical care. Without a secure airway, nothing else matters in critical care. Endotracheal intubation. Inserting a tube into the windpipe to secure the airway in cardiac arrest, respiratory failure, or trauma. Bag mask ventilation, an essential resuscitation skill before intubation or when intubation fails. Tracheostomy care, suctioning, cleaning, and maintaining artificial airways to prevent blockages. Bronchoscopy, depending on training and institution, helps remove mucus plugs, obtain biopsies, or assess lung pathology. Airway management is high stakes. If a patient stops breathing, the NP must act fast. These procedures directly mean the difference between life and death. In the ICU, heart rhythms can change in seconds. Defibrillation and cardioversion, restoring normal rhythm in life-threatening arrhythmias. Temporary pacing, used when the heart beats too slowly, often in emergencies like heart block. CPR leadership nurse practitioners are trained in ACLS, advanced cardiac life support, and often lead code teams. NPs don't just follow orders, they actively run codes, make quick decisions, and guide the team in cardiac emergencies. ICUs are like mini hospitals. Many diagnostics can be done right at the bedside. Lumbar puncture, checking cerebrospinal fluid for infections like meningitis or bleeding. Thoracentesis, draining fluid around the lungs to relieve breathing difficulty and analyze causes. Paracentesis, draining fluid from the abdomen, often in liver failure patients. Ultrasound-guided assessments, checking fluid around the lungs, heart, or abdomen, guiding procedures safely. These procedures give answers immediately. No waiting for the patient to go to another department. Faster diagnosis means faster treatment. It's not all about emergencies. Ongoing care procedures are just as important. Chest tube insertion and management for collapsed lungs or major pleural fluid collections. Wound debridement and dressing, preventing infection and helping recovery. Nasogastric and feeding tube placement, ensuring nutrition and medication delivery when patients can't eat. Dialysis catheter insertion for patients with kidney failure who need urgent dialysis. These procedures keep patients stable, nourished, and free of preventable complications while they recover from critical illness. So as you can see, nurse practitioners in the ICU aren't just advanced nurses. We're procedure-driven clinicians who stabilize patients, perform diagnostics, and respond in emergencies. Our scope may differ depending on the country and hospital, but one thing is clear. NPs are an integral part of the ICU team. If you learned something new today, hit like, subscribe to the Cosmic NP, and share this video with your colleagues. Comment below, what ICU procedure do you find most challenging or rewarding?